I'm going to say something that may make you uncomfortable, because it made me uncomfortable the first time I saw it with my own eyes. I've spent decades opening chests, stopping hearts on purpose so I could save them, watching monitors flicker between life and silence, and over the last few years, a pattern has become impossible to ignore. Older adults were coming into the operating room with hearts that looked older than their age, stiffer than expected, more inflamed, more fragile, not from genetics, not from lifestyle alone, from something far more ordinary, a drug so common most people don't even think of it as medicine anymore. They took it for pain, for inflammation, for just getting through the day. They took it because their joints hurt, their backs hurt, their knees reminded them of every year they've lived. It was prescribed casually, refilled routinely, swallowed daily, and slowly, quietly, it began to change their hearts. This drug interferes with the balance the heart depends on to regulate blood flow and pressure. In younger bodies, the system compensates. In aging bodies, it doesn't. Blood vessels become less responsive. Fluid retention increases. Blood pressure creeps upward. The heart muscle thickens, not stronger, but stiffer. Each beat works harder for less return. On the operating table, I could see it. Hearts that struggled to relax. Hearts that didn't tolerate stress. Hearts that failed not suddenly, but gradually, silently. When I asked patients what medications they took, the same answer kept coming back. Just this one. Everyone takes it. That's the most dangerous sentence in medicine. What makes this drug especially insidious is that it doesn't announce itself with a dramatic collapse. It doesn't cause immediate pain. It doesn't make headlines. Instead, it erodes the heart's resilience over time. Think of the heart not as a pump, but as a living muscle that must contract and relax thousands of times a day. This drug disrupts the chemical messengers that allow blood vessels to dilate properly. When vessels can't relax, the heart has to push harder, day after day, year after year. In older adults, this leads to a dangerous cascade. Elevated blood pressure becomes harder to control. Microscopic inflammation builds inside the vessel walls. The kidneys retain more sodium and water, increasing blood volume. The heart responds the only way it knows how, by thickening its walls. But a thickened heart isn't a healthy heart. It fills less efficiently. It starves itself of oxygen. It becomes vulnerable. I've seen patients who never had a heart attack, never smoked, never ignored their health, yet they arrived with heart failure. When we traced their history back, the common thread was prolonged exposure to this drug. Not abuse, not overdose, just long-term, safe use. The cruel irony is that the symptoms this drug causes, shortness of breath, swelling, fatigue, are often mistaken for aging itself. People assume it's normal to slow down, to get tired, to feel breathless climbing stairs. Meanwhile, the heart is struggling under a load it was never meant to carry for this long. And because the damage is gradual, it rarely triggers alarm until the system finally reaches its limit. In surgery, there's a moment when you touch the heart directly. No imaging, no charts, just tissue and motion beneath your hands. A healthy heart feels elastic, responsive, alive. A damaged heart feels rigid, reluctant, exhausted. Over the years, I began to recognize the difference instantly, and I began to recognize which patients were most likely to have it. Older adults taking this drug for years often show the same pattern: subtle heart enlargement, reduced ability to handle stress, increased risk of rhythm disturbances. The electrical system becomes irritable, irregular beats appear. The risk of sudden decompensation rises, not because the heart is weak, but because it has been pushed beyond its adaptive capacity. What alarms me most is how easily this damage could have been avoided or reduced. The body's inflammatory pathways are delicate. Suppressing them chronically comes at a cost. This drug blocks protective compounds that safeguard the heart and blood vessels. In short bursts, the trade-off may be acceptable. Over years, especially in older adults, it becomes dangerous. I've spoken to families who were stunned, but it was prescribed, but it was over the counter, but no one warned us, and that's why I'm speaking now. Because medicine sometimes moves slower than evidence, because habits outlive data, and because older hearts pay the price for our complacency. Pain relief should never come at the cost of cardiac damage that goes unnoticed until it's too late. There's another layer that rarely gets discussed. This drug doesn't just strain the heart mechanically, it alters how the heart responds to injury. When blood flow is reduced, even briefly, a healthy heart can recover. But hearts affected by long-term exposure to this medication lose that flexibility. The margin for error disappears. I've seen patients come through surgery who should have tolerated the procedure easily, but didn't. Their hearts couldn't adapt to the stress. Blood pressure swung unpredictably. Recovery took longer. Complications multiplied. When we reviewed their history, the pattern repeated. This is not about demonizing a medication. It's about recognizing that age changes physiology. What's tolerated at 40 can be harmful at 70. What seems mild can become cumulative. The heart doesn't forget what it endures. What troubles me is how often this drug is used daily without reassessment. Pain becomes chronic. The prescription becomes permanent. No one steps back to ask whether the benefit still outweighs the risk, especially when safer strategies exist. The heart is remarkably forgiving, but it is not invincible. When you ask it to fight constricted vessels, higher volume, and chronic inflammation at the same time, it eventually loses ground. And when it does, the consequences ripple outward to the lungs, the kidneys, the brain. By the time symptoms force attention, the damage is already established. Older adults deserve better than silent harm disguised as routine care. They deserve medications chosen with their hearts in mind, not just their pain. What I want people to understand is this: heart damage doesn't always come from dramatic events. Sometimes it comes from the slow accumulation of small, accepted stresses. If you or someone you love has been taking this drug regularly for months or years, especially past midlife, it's not a reason for panic, but it is a reason for awareness. The heart should be monitored. Blood pressure should be reassessed. Swelling, breathlessness, and fatigue should not be dismissed as just aging. I've watched patients regain stability when this hidden burden was removed. Blood pressure improved, swelling decreased, the heart's workload eased, not overnight but steadily. The heart, when given relief, often tries to heal. That's the part few people talk about. Damage isn't always a one-way street, but recognition has to come first. As surgeons, we're trained to fix what's broken, but prevention is quieter work. It doesn't happen under bright lights. It happens in conversations, reassessments, and the courage to question what's familiar. This warning doesn't come from theory. It comes from hands-on experience, from hearts I've held, from outcomes I wish I could change. The most dangerous risks in medicine are the ones we normalize, the ones that don't feel urgent, the ones that hide behind routine. This drug earned its reputation because it works, but that doesn't mean it's harmless forever, especially to aging hearts. If there's one thing I want to leave you with, it's this: your heart is not just another organ. It carries the cumulative story of everything you ask of it. Every pressure spike, every retained ounce of fluid, every year of suppressed protective chemistry. Older hearts need margin. They need flexibility. They need respect. Ask questions, revisit assumptions. Don't accept decline without understanding its cause. I've seen too many hearts damaged quietly to stay silent any longer. Warnings exist for a reason. I'm giving you mine now not to scare you, but to protect what matters most.